Hi, so I'm Joe. I'm a physiotherapist and I work in occupational health. And this is the third of a series of web chats looking at what are the important things that affect how we experience pain and how we respond to pain, and especially pain that's been going on for some time. And most importantly, what things can we do to help manage that? We as individuals can do to help manage that. So I'm lucky enough to be joined today by Kieran Breeden, who is a mental health specialist, and I'll pass over to Kieran to introduce himself in a little bit more detail. Kieran.
Hi, yeah, I'm Kieran Breeden. I'm a mental health nurse in occupational health at the moment. I've been a nurse for about 10 years now. Last couple of years in occupational health. And before that, I've worked in community mental health teams and in accident and emergency liaison as well.
Okay, good. So I've been really looking forward to this one of the series. I've had a little bit of an idea about some of the things that Sharon and Belinda have talked about, but I'm looking forward to learning a great deal from you here, Kieran. So, as physios, I often see people with persistent pain who have high levels of stress or anxiety, and whether that's kind of pain-related anxiety or not, or low mood or other mental health issues. Can you just tell us a bit about your experience of people with mental health issues, all those things that I've mentioned, and pain?
Yeah, I think much like yourself, I think there's a huge link between the two, without doubt. My experience personally is that perhaps the physical side of mental health problems is something that's a little bit neglected. I think that depression, anxiety, various other conditions do come with a physical component. We can't have any doubt about that, whether that be pain, whether that be sort of feelings of sort of the lethargy, the heavy sort of limbs, definitely present. Other physical things with more sort of trauma related stuff in terms of really intense sort of tension and stress, which is going to have its toll on the body and can lead to physical injury as well for people. So yeah, my experience has been that people often with mental health problems will experience some form of physical pain at some time or another, and are probably also seeing a different service for that, as well as seeing a mental health professional. And that if they don't give attention to both, I suppose something that can get really quite serious.
All right, yeah, I think that's a really interesting point about how the the physical and the mental inevitably they're linked, aren't they? So you talked there about mental health issues, and can you tell us a bit more, Kieran, about how some of those factors that you've just mentioned, how they can have a role in amplifying pain?
Yeah, I suppose if you're looking at it in a sort of more of a holistic sense, you've got one of the sides of mental health problems is the cognitions that people will have. So particularly anxious type thoughts, perhaps if someone's feeling quite anxious, whether they've been diagnosed with anxiety or not, those type of thoughts can be the sort of should things. So really quite difficult thoughts for people are thoughts that involves a should. For example, I should be fine, I should be fit and well. So therefore, when they get any kind of aches and pains, it can really kind of amplify that, because in their mind they think I should be like this. The other kind of ones are things that sort of can get into people's mind, I suppose, to depressive type of thoughts, cognitions of kind of I'm sort of useless, or I'm not able to do these certain things. I suppose if that then leads to certain behaviours like staying still or avoiding certain things, then absolutely that can amplify someone's pain. Equally, anxious and sometimes some trauma responses have been really sort of affected. Being in that fight or flight state for a prolonged period can actually cause people to physically tense up. And I suppose if you had an existing pain or an existing area of pain, then holding yourself in that physical tension in that state for a long period of time and not wanting to move is probably going to make that worse as well. Likewise, the more anxious thoughts as well of things such as people can actually start to worry about worrying as well. So you might sort of think that, I'm never going to be happy because I'm always in pain or I'm always worrying about pain. So it starts off that cycle again, and then in behaviours wise, that can lead to something maybe avoiding using a certain part of the body that's in pain. You'll know more than me of whether that's recommended or not, but there may be places where you're having, perhaps a physio recommend that you do some exercises on that area, but because of the level of anxiety that people have got about that, or the worry about the pain, that they might avoid doing that. But that doesn't help it get better, and then it can kind of get stuck in a bit of a cycle, really.
Okay, so that's really interesting, and a lot of kind of things there to to consider about how one's thoughts can have quite a big effect on what you do and how you might behave physically. Can you give us what are your kind of top tips, if you like, Kieran, for someone, and you've mentioned anxiety a few times there, for someone with high levels of anxiety, which is contributing to their pain experience? What would your advice to someone like that be?
I think if someone's noticed that it's a really high level of anxiety with that physical sensation, the things that people might get, the shortness of breath, sometimes even chest pain, butterflies in the stomach, feeling really tense all the time, combined with the sort of thoughts that we mentioned in there, the sort of anxious thoughts of almost like worrying about worrying, or sort of I should or shouldn't do this. I would say that's probably a time to maybe think about coming to see somebody in terms of mental health, a professional, whether that's talking therapy, whether that's your GP, or somebody kind of seeing if you can get, there's various different sorts of treatments, loads of different stuff. Some people will try medication, other people are more comfortable with the talking therapy, or people looking at more things like mindfulness and meditation and things like that, which can be really helpful at the moment for a lot of people. Just in terms of sort of settling some of that down, the key points with things like the mindfulness is to allow the thoughts to come and go so that you can focus on what you're doing in the here and now. And if you can find that people can do something like that to allow them to do maybe the exercises that perhaps the physio's given them just for that short time, or even if it's something that may be present for a long time, often mindfulness and meditation can be helpful with not necessarily avoiding that feeling of pain. If you've got high anxiety about it, you can gradually build up to start to just have that experience and maybe reduce the fear about having that experience of pain. That's often a good way as well. But I would certainly say talking to somebody and trying to get the advice, because it'll be different for different people. Even with something like depression and anxiety or something like that, that doesn't mean that everyone with depression and anxiety has got 50% depression and 50% anxiety. It can be, many and varied at different times in people's lives as well. So I would say definitely talk to anyone who's available, who might be able to help with that, and make sure you know sort of all the options and pick the one that feels right for you.
Right. Okay. Well, I was just about to kind of ask an additional question there, and you've answered most of it, I think, Kieran. And that question was going to be that if someone has pain, they've had it for quite a long time, and they perhaps naturally feel somewhat anxious about it or what it might mean for the future. Is there any advice that you would give someone about kind of when they ought to seek help, or when, if they feel that they're managing that kind of okay themselves? Is there anything that you kind of guide people on, or do you just think that you mentioned there at different times in your life you might one thing might seem the right thing for you to do? When's the time to seek help, I suppose, is a question I'm asking.
I suppose, the time to seek help in terms of your mental health is almost certainly going to be if you find it's really impacting on your day to day. If you find that you're say in this kind of situation, if you say I'm not able to work, or I'm really struggling with something because of the combination of the pain and my mental health, then absolutely at different times, like I say, depending on people's experiences, what they've been through before, what opportunity they've had to talk about things before, they might already have some strategies. But in terms of a a long-term approach to pain, if it's a pain that isn't, or almost certainly isn't going to go away, then I would say it's a time to seek help if you find that the daily life is a struggle, and if there's any significant change, and you feel that you're not able to do the things that you were doing before.
All right, thank you very much, Kieran. So just to summarise things that I thought kind of really stood out there, I really kind of, it really chimed with me, those things you took, like should thoughts, I should be doing this, I should be feeling like this, and how thoughts or feelings might lead to behaviours such as avoiding certain activities or situations. And that certainly fits in with my experience as a physio, that I will really quite often see people who have pain and might feel anxious about that pain, or might have other anxieties as well. That leads to the kind of muscular tension, that kind of physical manifestation that you've mentioned. It leads on to avoiding activity or certain activities or positions or things that they might previously have enjoyed doing or been able to do. And the problem with that is that their body, when they are asked to do those things or to do more than they're used to, their body's really sensitive to that, and it hurts. And then that really hits that vicious cycle that you've just mentioned. It's really interesting to have your insight, your really in-depth insight about how anxiety, tension and other mental health issues can have a big impact on that. So thanks very much for that, Kieran. That was really, really interesting. Anything else to add?
No, I would agree with you there that word should in your thoughts is probably the greatest enemy to good mental health that you can have, if I'm honest. Yeah, you're right. So I think it's more about people giving themselves a bit of a break with that. Even the simplest thing, catching yourself if you're thinking that, I should be pain-free, I should be this or that. And just always being easy on yourself with things like that, with your expectation.
All right, thanks very much, Kieran, and I hope everyone that's watched that has enjoyed it as much as I have. Thanks very much.